For shoulder flexion, gravity resisted, begin with the patient in a seated position. Assess the normal range of motion. Palpate the anterior deltoid cor brachialis. Have the patient perform the motion. The patient's arm should start at 90 degrees. Stabilize the ipsilateral shoulder and apply increasing resistance over the distal humerus in the direction of shoulder extension. That was a 5. For gravity eliminated, the patient should be laying on their side with their arm extended at 90 degrees, with the arm resting on a low friction surface. Stabilization and palpation remain the same. Shoulder extension, gravity resisted, the patient should be laying face down and their hand should be fully internally rotated. Assess the available range of motion. Stabilize the ipsilateral thorax and palpate the teres major muscle and the lateral border of the scapula. The patient should extend their shoulder. Increasing pressure should be applied over the distal humerus in the direction of shoulder flexion. Good. That was a 5. For gravity eliminated, the patient should be laying on their side. The arm should be resting on a frictionless surface. Stabilization and palpation remain the same. For shoulder abduction, gravity resisted, the patient should begin seated. Assess the available range of motions with their palm down up to 90 degrees. Stabilize over the ipsilateral shoulder. Palpate the middle deltoid muscle and the superior lateral aspect of the humerus. Bring the shoulder up to 90 degrees and apply increasing resistance to the distal humerus in the motion of adduction. That was a 5. For gravity eliminated, the patient should be lying on their back with their arms resting at their sides. Stabilization and palpation remain the same. For shoulder internal rotation, gravity resisted, the patient should be in prone with the head rotated to the contralateral side. The humerus resting on a towel with the shoulder at 90 degrees of shoulder adduction and elbow flexion. Assess the available range of motion. Stabilize over the ipsilateral thorax, palpating the subscapularis muscle on the anterior surface of the scapula. Apply increasing resistance in the direction of shoulder external rotation. Good, that was a 5. For gravity eliminated, the patient should be in prone with the entire upper extremity hanging off the table. Stabilization and palpation remain the same as the patient externally rotates their arm. For shoulder external rotation, gravity resisted, the patient should begin in prone with the head rotated to the contralateral side. The humerus resting on a towel at 90 degrees of shoulder adduction and elbow flexion. Assess the available range of motion. Stabilize over the ipsilateral thorax and palpate the subscapularis muscle on the anterior surface of the scapula. Apply increasing resistance proximal to the wrist in the direction of internal rotation. Good. That was a 5. For gravity eliminated, the patient should be in prone with the entire upper extremity hanging off the table. Stabilization and palpation remain the same as the patient internally rotates their arm. For shoulder horizontal adduction, gravity resisted, the patient should begin in supine. The patient's shoulder and elbow should be at 90 degrees. Assess the available range of motion across the body. Stabilize the ipsilateral shoulder and palpate the pectoralis major muscle just inferior to the lateral third of the clavicle. Apply increasing resistance at the distal humerus in the direction of the horizontal abduction. Good. That was a 5. For gravity eliminated, the patient should begin in a seated position with their shoulder and elbow at 90 degrees, placed on a low friction surface. Stabilization and palpation remain the same. For scapular elevation, gravity resisted, the patient should begin in a seated position with their head turned away from the tested side. Assess the available range of motion. Palpate the upper trapezius near its insertion point on the clavicle. Apply downward resistance over the superior aspect of the acromion, as well as the anterior lateral resistance to the occiput. That was a 5. For gravity eliminated, the patient should begin in prone. Assess the available range of motion. Stabilization and palpation remain the same. For scapular abduction and upward rotation, gravity resisted, the patient should begin in a seated position. Assess the available range of motion up to 125 degrees of shoulder flexion. Stabilize over the ipsilateral shoulder. Palpate the serratus anterior on the lateral surface of the upper 8 to 9 ribs. Apply simultaneous resistance on the scapula and the distal humerus, trying to derotate the scapula. Good, that was a 5. For scapular adduction, gravity resisted, with the patient in prone, rotate the head to the opposite side. Position the shoulder, an internal rotation and extension, and rest the back of their hand on the ipsilateral gluteal region. Standing on the contralateral side, stabilize the contralateral thorax and palpate the rhomboid between the scapula and cervical thoracic vertebrae. Apply increasing resistance under the medial scapula in the direction of scapular adduction and upward rotation. Good, that was a 5. For gravity eliminated, the patient should begin seated. Position the shoulder in internal rotation and extension and rest the back of their hand on the ipsilateral gluteal region. Stabilization and palpation remain the same. Good. For scapular adduction and depression, gravity resisted, the patient should be in prone position and rotate the head to the opposite side. Abduct the shoulder to 130 degrees. Assess the available range of motion. Standing on the contralateral side, stabilize the contralateral thorax and palpate the lower trapezius between the scapula and lower thoracic vertebrae. Apply increasing resistance to the lateral aspect of the scapula while the patient holds their arm out. There is no gravity eliminated for this motion.